Hello, I'm Katie James. I'm the educator here at Medela and I'm also a midwife and lactation consultant. Now, one of the most common questions mums have is, how do I know my baby's getting enough milk because I can't see the milk going into them when they breastfeed? It's a really good question, and what I'm going to talk about is the first couple of days, because they're really easy to tell that your baby's getting enough. Firstly though, it's really important to say that in that first month, babies need to feed about 8 times in 24 hours. Often they might feed much more frequently than this, but that's the minimum in order to know that they're probably having enough access to the breast. So what else can tell you that your baby's gaining enough food? Obviously, if they're gaining weight. Now, what we see at the beginning is babies will often lose some weight. Perfectly normal, as long as it's within those safety categories, and your midwife will be able to tell you about that. But also then we'll start seeing them gaining weight after that, about 4 days. And the reason for that is because at the beginning you have such small quantities of this colostrum milk. It's high in sugar and low in fat, really. But then when your milk comes in, and you'll know it has because your breast will probably feel much fuller and heavier, the quantities of milk rapidly increase. And how we can see that babies are getting enough milk is actually by their wet and dirty nappies. So in the beginning, in the first few days, babies will have one wet nappy on day 1, 2 wet nappies on day 2, 3 on day 3, until about day 5. And then by day 4 and 5, because you've got much bigger volumes of milk, you'll actually find that your wet nappies, and I've got one here that I've soaked, not with wee but water, are actually quite heavy. And if you compare that to an empty nappy, you can feel the difference. I would suggest you maybe, for example, if you're not sure what your baby's doing, is pour 50 mils into a clean nappy and have a feel of that compared to a new nappy. The other thing is that once babies hit about 5 days, they probably want 5 to 6 heavy wet nappies every 24 hours, and this is really important. If they're any less than that, then I'd advise you talk to your midwife and go and check that baby's feeding well enough. The other thing to look at is their poos. Now, I have a dirty nappy here, but do not panic, it's not real. In the beginning, babies have meconium, and meconium is like tar, black, green, really sticky. And then as the milk starts to increase in volume, it will become maybe greeny brown, and then browny yellow, and then around about day 4, we want to be seeing these yellow, mustardy, pumpkiny poos. And I'm going to show you this, and it's a homemade poo, but this is peanut butter, and you can see, if you can see close enough, that this is looking pretty yucky, but it's also got little seedy bits in. So babies' normal nappies, breast milk poos, is quite runny, very yellow, and with seedy bits in. So I actually describe it as a bit like English mustard mixed with whole grain, but quite watery. And they should have 1 to 2 of those, about the size of a dollar coin at least, every day. I'm sure when your baby gets feeding, you're going to get a hell of a lot more. So the best way to tell your baby is getting enough is to look for those wet nappies and the changes in those pooey nappies, so that we're seeing yellow, watery, seedy poos from day 4. So for more tips like these, please join us on our Medela blog, and we'll give you lots more advice. Thank you.